Hello and welcome to another episode of Sisterhood of the Scalpel. I am Dr. Julie Khanna.
And I'm Dr. Maryam Zamani.
And today we're going to talk about the men in our group because we have a lot of men in our life. And one of the things we're going to talk about today is breast surgery in men. And it's funny that it is the second most common operation we do in men. And last year it was reported that by the American Society of Aesthetic Plastic Surgeon, over 25,000 cases
25,000
of male gynecomastia surgery was performed. And we don't do 25,000, but we do a lot of it here at ICLS.
So when we're talking about doing this gynecomastia surgery, male chest enhancement, this is what we're talking about. We're talking about how can we help our male patients achieve that transformation from Chris Pratt in Parks and Recreation to Avengers body. Now, granted, this is all hard work that he put into this, so much kudos to him. But certainly a lot of our patients out there are also putting in a lot of hard work, and sometimes they just need a little bit of help getting to the finish line. So we're here for the end game for them.
Oh, my son's going to be so happy you said that, the marble reference. So when we talk about male chest enhancement, what are we talking about? So we're going to look at their skin. We're going to look at the fatty tissue underneath the skin, the glandular tissue. This is the actual breast tissue. Men do have breast tissue. And also the pectoralis muscle. So we're looking actually at all those things. And last but not least, and we're going to touch on this one, is even the nipple, because that's a lot of the reasons why guys come in is to talk about the nipple and the areola, that brown area around it. So when we're talking about surgery, we're addressing all of those aspects.
So let's show a little bit of what we're talking about. This is how we see our approach at ICLS male chest enhancement is that we see it. I always like to talk about, I'm running out of tiered foods. I'm just going to put it out there. I know that Dr. Khanna hates this slide, but it's the most masculine.
I don't hate this slide.
Here,
I'm vegetarian. I think it's backwards, but that's okay. You go with your food then.
This is our luxury seafood tower. Okay. But in a luxury seafood tower, as you all know, the lobster is the king of it all. So we're going to start from so we're building downwards because the bottom layer here is the most important layer. Anyway, so when we're looking at enhancing our male chest appearance, we want to address things. So first off, we will talk a little bit about doing our vasor liposuction. Again, this is not your basic traditional liposuction, just uses ultrasound energy that not only helps break down the fat smoothly, but also gives us some skin tightening, which is essential and is always a good complement to any liposuction where we're doing, and also taking out any extra gland that we're doing. That's our starting tier. Next is when we have a little bit of excess skin that still stays behind, and how can we try and enhance that? And that's when we have our additional technologies, our radio frequency based scarless skin tightening, where we're not cutting out big amounts of skin. Sometimes we still do need to do that, but if we don't need to, we try and avoid that, because again, after all, you're doing this so that you can enjoy having a shirtless appearance. You don't want big scars. And last but not least, sometimes you want to even enhance that muscle, that pectoralis muscle definition. That's when adding some fat grafting can certainly help. And this pairs really nicely with a bottle of wine, or in this case, physique liposuction or muscular etching. So we'll certainly touch upon that as we go forward.
This is my favorite slide. When we're talking about male chest enhancement, what are we looking at? Well, we're looking at the different components. And, if you look on the slide on the right, or the diagram on the right, you're going to see the green is the area to go, and the yellow is the area that we're contouring. The male chest, actually the upper chest should stick out more than the bottom. And that's kind of the reverse of female chest. So having studied this extensively, particularly with the Chris's, this is something, as women, we look at this a lot. And it's that squaring off of the chest. It is the exact opposite of the female chest. We want roundness, we want softness in the female chest. Here we want more etched lines, harder lines, more rectangular, more sharp definition.
So let's look at what a few patients have been able to achieve with this.
So if we look at a standard case where this is using vaser liposuction, you know, this is a kind of patient that some surgeons might say you have to cut out skin. And I think if you don't have technology, your likelihood of cutting out skin in a male chest is much higher. So I always say, let's try. Our approach, Dr. Zamani and I, is we want to do everything we can to avoid that scar. So this has a scar around the areola and a small incision in the chest. These are 0.5 centimeter to 2 centimeter incisions, and that's it. And this is vaser liposuction. Now, there was a lot of fatty tissue in this, and you can see how the skin contracted with this vaser liposuction. Look at that lateral, droopy looking chest where you're thinking, oh my God, I'm going to have to cut out skin, and we can get away without it. Other thing I really want to point out here is look at that areola. A lot of patients come to us and say, my areola is puffy, it sticks out too much. And we always say, just wait, give us a minute. This was without cutting skin. Look how much it shrank. Look how much it tightened up without having to do skin excision around it.
And this is another patient again, very similar scenario, a little bit older gentleman, but again, having that excess fat, excess gland, and also excess skin. This is another scenario where someone would have maybe suggested cutting out skin, but we don't need to do that. Again, we're seeing with using our energies appropriately, we're getting that smoothing up the chest. We're seeing how the shadows have now shifted, the highlights and the shadows, where you're not seeing any of those more feminine appearances of the chest area. Now it looks like a much more masculine chest with minimal scarring. So this is a really great example here. And here is an example of where we've been able to pair this procedure really well with someone who's was already improving their lifestyle, being more active, but also doing a bit more trunk liposuction. So you can see how now the whole trunk and chest area complement each other with physique liposuction being added as well. This is the example of what you were alluding to earlier, Dr. Khanna, about how sometimes the areas that are of concern is also the nipple or the areolar portion, the pink area on the chest. And sometimes
we have extremes.
We have the extremes. We have instances where, this is a patient who worked so incredibly hard to really turn his 180 degrees, became incredibly fit, but sometimes there's memories that stay behind. Sometimes the skin laxity is just too much. And when it's the right time to say that we do need to complement what we're doing with a little bit of skin excision, that's absolutely fine to do as well. Sometimes there is that indication where we know that technology can improve, certainly, but sometimes we do need to excise skin. And the key here is that this patient has scars, but you can't really, it's not a kind of scarring that sticks out, because where we see the scarring is exactly where your eye is supposed to see shadows. So we're following that definition of that pectoralis muscle to actually accentuate the appearance rather than to distract from it.
Well, it's funny because we see a lot of this when we go to meetings, and they take the scar straight across the chest. And when you get into that armpit area, and if you look on the side view there, if you have a scar sticking out from the breast onto the chest, it just draws your eyes because it's not right. So again, what we like to do is follow the muscle, hide scars. Plastic surgeons don't make invisible scars. Scars are there. We should just be much better at hiding them in strategic lines. Now, this young man also had skin excision on his tummy because of the dramatic weight loss, and you can see how that enhanced the whole result. And also, I want you to notice that side chest. Look at that little bit of fat grafting that went in there, that divot in the chest. We got a really nice appearance of the chest. He's already got good muscles in there. We just helped define them a little bit better.
Mm-hmm. And then, but here's what we're talking about when we're talking about technology. So what's really out there in terms of what we can do? Sometimes, like we're saying, we can get away without doing the skin excision, and that's thanks to energies like this. You may have, if you search online, it's called radio frequency skin tightening. You may come across it being known as Body Tight, J Plasma, Renuvion. we're blessed that we have all of these technologies and more at our
We have everything.
we have everything. So we know exactly what works best for which patients. What this allows us to do is that it's almost like a little pencil that using those 1 centimeter, those small incisions that we're talking about, scars, going underneath the skin, it heats up the skin from underneath, causes immediate skin tightening, but also what it does is that it stimulates your own skin to become stronger, build more collagen, get better quality. And there's nothing else that can beat it without doing more surgery right now. And then we get into where we really, we talked about how can we complement things? How can we really accentuate? And this is an example of where we had a patient who was already in fantastic shape, had already put in the great work, but wanted more definition in the chest area, but also in the truncal region. And this is where we paired our male chest enhancement with our muscular etching approach. And if you haven't had a chance to see our liposuction video on where we talk about the many layers of liposuction, including physique liposuction for men, as well as muscular etching, please check it out. This gives you more information on that, but very briefly touching upon it.
So I think the key here is that when you look at muscular etching, it is unveiling your anatomy. And that is really key.
Absolutely. And this is just, again, an accentuated side view of that same patient where, again, we're seeing how those lines can look natural, enhance his own muscles, not chiclets superimposed on your body.
Exactly.
All right. So we bring
we're back. Okay, I'm also vegetarian, which is the other problem with this slide.
So now we understand a little bit is we start, again, starting off the bat, starting out of the gate running, we're using our vaso liposuction, which is using technology to get skin tightening, to get that improvement with our gland removal using the small scars. Then if we need to, we add our scarless skin tightening with radiofrequency, where again, we're trying to avoid big scars. That's another layer. If we need to, if we want to, we can add fat graftings for muscle enhancement. That's our lobsters in the bottom layer there. And if we want to really top things off, enjoy a beautiful meal and surgery, physique liposuction and muscular etching for the right patient to help enhance their own anatomy.
Why do surgeons love food? Thank you for joining us here on SOS. Please do send us your questions, DM us. We will answer. We do have an question and answer period all the time. Follow us, Dr. Zamani.
Don't forget to subscribe.
I don't know what to say about that. And we look forward to seeing you again in another episode of SOS.